Yeah, you have 15 minutes. Your team has 16 minutes, 15 minutes to present, then 5 minutes for Q&A. All right. Are you guys ready to begin your presentation now?
You're speaking on mute. If you're speaking.
Nadi.
Okay. So we have our last speaker. I didn't join. Okay. She has joined now.
All right.
Okay, we are complete. We can.
Okay, you start now. 15 minutes. Go ahead. Over to you.
Please, can you hear me now?
Yes.
Okay. Before we start, I want to apologize because some of our members are in NYSC camp and they can't turn on their screen. So that's why. So, good day, everyone. We are data readers, and today we want to talk about 18 billion naira. This is exactly how much money is missing yearly from the dental industry in Nigeria. And this is not because people don't want dental care. It is because the system is designed in a way that it makes it difficult for them to get early access to it when they need help. My name is Oluwapelumi Adeoye, and data readers, we have spent the past few weeks trying to understand why this is happening and how we can provide a solution. And what we're about to show you isn't just a tech project, it's a direct intervention into a healthcare crisis that is affecting people's health and revenue. So let's dive in. Next slide, please. Okay. So we did not just start our solution casually. We started with an hypothesis that the Nigerian dental system is fundamentally broken because it is reactive, not proactive. So we conducted a survey and we had 100 respondents. And what is shocking is that out of these 100 respondents, 51% claimed they had never been to a dentist, even once in their life. And 33% stated that they have not been to a dentist in the past 2 years. So this means that 84% of our respondents are essentially avoiding dental care. So I know you are wondering that 100 people for the sample is not enough. So we cross-checked our numbers with global data, particularly the WHO Global Health oral reports in 2022, and also studies from the Nigerian Journal of Clinical Practice. And guess what? Our data aligns perfectly with this. We found out that over 90% of dental issues in this region are left untreated. And this is due to the same reason we have uncovered in our own findings. So we asked the important question, why are people avoiding the dentist? In our analysis, we found 3 major problems, and 2 of these are directly affecting dental clinics' revenue. We found out that 42% of the market claim they are too busy and that the waiting times at the clinic are too long. And 39% claimed embarrassment or fear as the reason why they do not visit a clinic. And here's the thing, the dental clinics in Nigeria are basically set up in a way that they make profit from late stage painful procedures. So the 42%, they are completely missing out on the 42% of patients who claim they are too busy and cannot go in due to booking appointments and waiting rooms, which basically wastes their day. So, and this is easy wins and early revenues that the clinics are missing. So we estimated that the dental clinics in Nigeria collectively miss over 18 billion naira annually in revenue. And that sorry. And this is not because people don't want dental care. It is because the dental clinic, dental system in Nigeria are set up in a way that it makes it difficult for people to access them only when it is not an emergency. And another thing we found out is that people do not understand why. No, go back. I'm not done with that slide. People do not understand why oral health matters, and they do not know that a small cavity today can become a root canal tomorrow, or that gum diseases are linked with heart disease and diabetes. And this is directly linked to SDG 3, good health and well-being. And this is not just a business problem. It's not just a business problem. We are also facing a knowledge gap issue, and this is costing Nigerians their health. And this is where oral sight comes in. So what is oral sight? Next slide, please. So oral sight is a mobile first tool that scans photos so that users can check their dental health. And oral sight, this is how it works. First, it is integrated seamlessly, and users can input their photos and answer a few questions, and the program and the system processes this without having to check in into a dental clinic for people that cite that they are too busy. And secondly, it predicts dental risk with high accuracy. It flags early signs of dental conditions, so users can take action before they enter the expensive late stage. And number three, it provides actionable guidance for patients. So we do not just tell patients that there's something wrong with them and leave them hanging. We connect them with partner clinics, and high-risk patients are connected to partner clinics through a live chat and fast tracking booking. So oral sight basically simplifies early dental screening and reduces unnecessary waiting time, and ensures that high-risk patients get timely attention, and it creates a generic revenue pipeline for dental clinics, and they have access to the 18 billion naira that they lost access to. So next up is my colleague Zach. It will take us through why machine learning is the right tool to solve this problem.
All right. Thank you very much for the intro, Dr. Pelumi. So we were asked why machine learning is the right tool for this problem. Basically, we all know machine learning solves the limitations for manual screening in three critical ways. Firstly, it delivers instant analysis, which are available 24/7. This eliminates the long waiting times and scheduling conflicts that currently that currently keep patients away from dental clinics. It also offers unmatched scalability. While a human dentist can only see one patient at a time, our model can screen thousands simultaneously, driving massive operational efficiency for dental clinics. And also its capability, it provides precision in early detection for patterns invisible to naked eyes. And unlike a static checklist, it features continuous improvements, getting smarter and more accurate with every single user data. Definitely. Next slide, please. So what exactly will this project deliver? The financial ROI. This project particularly delivers clear, measurable business value to our dental clinic partners across four main key financial pillars. And this is how we ensure investment in oral sight pays off. Firstly, we drive predictable high intent revenue. Oral sights as a revenue generation engine that identifies high-intent patients who are currently avoiding clinic due to the long waiting times. This creates a steady high conversion pipeline for all patients with clinically validated need, increasing billable appointments and making the clinic revenue significantly more predictable. Secondly, we optimize high-value share time. By using high accuracy error scoring, clinics gain immediate visibility into which cases are genuinely urgent and emergency. This dramatically reduces the friction and waiting times for high-value patients, significantly increasing patient inflow and optimizing their most expensive assets, the chair, leading to higher daily throughput without needing extra staff or extra working hours. So thirdly, We function as a clinic retention and reactivation tool, building loyalty. We will manage the long-term patient relationship via automated 6-month checkup reminders and personalized follow-up guidance. This ensures our patients maintain their care routine and return consistently to our partner clinics, leading to stronger automated patient retention and lifetime value. While we will also be reducing operational and triage costs by filtering and scoring cases digitally. The system handles low priority checks, so clinic staff saves this time and focus only on emergency and urgent cases. Furthermore, by providing structured and photographic evidence, the tool supports claims integrity for insurance providers, improving documentation and speeding up clinics' critical reimbursement cycles. Next slide, please.
Team Data Readers, you have 3 minutes to go.
All right. So we already have the data to win. Actually, as we all know, for any AI project, data is the fuel. Our strategy is to secure that fuel in 3 folds. Firstly, we are bypassing the need for millions of images by using transfer learning model. We start with open source data set for the basics. Secondly, we refine this with partner data. We are establishing agreements to access anonymized clinical records to teach the model certain differences it should learn. And finally, once we launch our pilots in the 5th month, we will activate our active learning pool, where every new user, photo verified by a dentist, becomes a new training data, making the model smarter every single day. Furthermore, we are not wasting any time on capital training or poor quality data. We have automated quality checks that works in 2 ways. First, the quality gates, which auto rejects any blurry or poor quality photos before they ever reach our training pipeline, maximizing our efficiency. Secondly, our active learning pool constantly flags the most challenging complex cases and sends them to our partner dentists for human review. This continuous feedback mechanism ensures AI is not only accurate today, but is constantly getting smarter, guaranteeing continuous improvement and accuracy after we launch. In short, we have the necessary data sets and we have the necessary quality controls ready. Next slide, please. Slide 7. So I'll be talking about our 4-phase delivery approach. We know speed is paramount. Our entire go-to-market strategy is structured around a focused 6-month execution timeline, broken down into 4 distinct manageable phases. We have the phase 1, which is the foundation month. That's the first 2 months. We kick off the first 2 months with foundation work. This is where we build the MVP products, the web app, the actual tool the customers will be using, which utilize the data we just discussed to train our baseline computer vision models. At the end of the month 2, the core product is built and functioning. Phase 2 is the integration month, the next 2 months. This integration month, we move to a controlled beta deployment with up to at least 50 test users. This allows us to prove the technology works in a living setting. Simultaneously, we finalize the scope of our B2B API integration with partner systems preparing for scale development. Phase 3 launch, which is the 5th month, we rapidly roll out to 500 users to stress test the system capacity and user experience. Crucially, this is when we activate our active learning data pool in a live setting, allowing the AI to start collecting real-time feedback and improving its accuracy. While the 6th month is the validation phase, our final month is all about proving the investment works. We rigorously benchmark the AI's final accuracy against our performance metrics. Most importantly for you, we generate the final ROI reports. The 6-month timeline accumulates in clear data that proves the technology is viable and scalable. Then we deliver a return on your investments. My colleague will finalize on the key challenges, or addressing the key challenges. Then go over to you, please.
Thank you very much, Ayomide. So we have identified 3 major challenges that can go wrong with using Oral Sight, which is our product. First is poor data quality, which could be as a result of the users snapping blurry or dark photos. The second is the mistrust with using machine learning models on the part of the dentist. And the last challenge that we've identified is low user adoption. So to mitigate the poor data quality, we have a quality gate that can instantly reject It will instantly reject poor images or blurry images, and also guide users on how to take good images so they can get an accurate result and also get the help they need. So on the part of getting the dentists to trust us, we know we have implemented heat maps that the AI will show how it got the results it got, so they can trust that, they can trust the accuracy, and they can also see the process that the model has taken to achieve the results, to say, okay, this person has a dental cavity, or this person really needs to see a dentist urgently. Then lastly, for the low user adoption, we have implemented, or we aim to implement, a no login a low login process, and that's way they don't need to be scared whether they are putting in their information. And also we ensure that users do not snap their faces, so that way there's no recognizable information. Next slide, please. Okay, for the team and resources that we need, we've got Angelic, which is our computer vision engineer. Then Ayomide, our project lead and clinical advisor, and Temitope, myself, the researcher and the business analyst. Then we have Saravanti, our full stack developer. Then we have Ezekiel, Melumi, and Tochuku, our data engineer and machine learning engineer. So the technology we're using for Oral Sight, which is our product, is cloud GPU compute, development workspace, and computer vision for training and validating the AI model. For access, we've got anonymized dental image archives and partner API sandbox for triage, referrals, and also model development. Next slide, please. So at this point, we're seeking your support, we're seeking your sponsorship and approval, so we can proceed in this 6 months timeline that we've got to make our product Oral Sight a reality and fit to be adopted in various dental clinics. And the next immediate action, it will be doing a 1 hour scoping session with our data engineering and product team to finalize our data pipelines and confirm the integration need. We believe this project is really important because it will help dental clinics gain more money. They won't be losing customers anymore because the customers. All right. Thank you very much for listening to us. And now we leave the floor open for questions.
Ben, do you want to go first?
No, Sean, you can start with this.
Okay, I have possibly a couple of questions hidden there, but mostly I wanted to give you some feedback. I like this, and thank you all for inviting us to give you some feedback and ask questions. I loved that you began early on describing why is this happening, and you stated that you had a hypothesis, that there was a broken system, it's reactive. I'm glad that you recognize that 100 cohort population is not enough. I'm very happy. I was very surprised and pleasantly surprised that you confirmed with the World Health Organization and your data aligns. Fantastic. I give you kudos for that. Where I had trouble was connecting the reasons that this is a problem. People are busy. There's embarrassment, fear, cost, long wait times, impacts customer churn, impacts working on minor cases and then managing emergencies. I had trouble connecting those drivers with the unique differentiator. So that in the solution. So that was a bit of a challenge for me. On the why slide, the feedback I would give you is, I think you spoke about why ML would solve for this. And you illustrated the benefits of ML rather than the benefits for the solution is how I received that, how that came across to me. The ROI was a little vague. There were vague terms like more predictable and optimize and reduce. And I think it would be helpful to support some of the claims with more concrete data. On the data side, on the next slide, there is data that exists to test ML, and data will certainly improve models. But I think I needed to hear a little more concrete information behind that. On the roadmap, I think My sense is you're guessing at 50 users and 500 users. Typically, there's a process by which you create a rapid prototype and you test it out. And a small portion of people, a small percentage of those people will say, yes, this is great. A smaller portion will say, it's okay. And then there's a third portion that won't really care. And if you focus on that first portion and you continue to grow that, there's a point where you hit a magic number that's in the 40% range. And when you start to get into the low 20s, that's a good indicator that you're heading in the right direction. Keep going and serving that small constituency and making it better and better. It's just product management stuff that you learn over the years. And so those numbers would be more realistic than picking 50 or 500 users arbitrarily, because you don't know how you would get to those generally. So that would be the feedback that I would have. The risk and mitigation, I've actually seen a similar presentation for a different part of helping people. Rather than dental, it was more related to hair, where people would, and so the same challenges that you identified in risks existed in the other. So I think you were spot on with those. I'm really glad on the last slide that you're asking for the order. You're saying, how can you help me? What support do I need? But I think it does need to be a little more concrete in terms of timing or resources, funding, or other things. That's my feedback. And I really appreciate this presentation. I was very impressed, particularly with the beginning part. I think you started out really strong with what it is you're trying to solve for and what the constraints are at the beginning. So that's what I can share back. Hopefully that helps.
Thanks so much, Sean.
Thank you.
So I wrote here, Ron, and that's true. You could see Sean also picked it. I wrote it down, right? You've got the best opening of all the people, all the groups we've talked to today, right? Your opening was fantastic. But you know what? You lost steam. I don't know what happened. So this is me not talking about the solution. This is your presentation. Your opening was fantastic. It got me so curious and so anticipated to see what's coming up next. If you could recall, I gave you thumbs up while you were opening. I did that. So that was a very fantastic opening. But there was this loss of steam as you proceed. Probably you need to work more on your presentation styles, and that opening is, you just buy everybody in. If you do that, you've told me, oh, there is a problem. This is the problem. This is how we're going to solve the problem. And this is what we see. And this is who I am. Everybody's curious. Everybody wants to listen to you. So maintain that same kind of vigor when you're going down the full presentation. I thought you lost him somewhere there. So let's go back to your product. I'm sure I said it all. There's absolutely nothing more I'm going to say. I didn't see anything on the ROI. I did not see it. That one is absolutely not there for me. I don't see, go back. I love your resource. You've been able to, I actually asked a team that question. Sorry, it's because I saw the resource slide. Go back there, please. Let me start with that. I asked a team that, what are you looking about? You talked about resourcing, the engineering within yourself. Go back to the next slide. I think it's on the next slide after this, after you talked about that. Yeah, no, this is the roadmap. Go back. Is it here? Where you put yourself into a team of the engineers to build out this product. Yeah, here you go, the resource needed. I love this. This is the first time I'm seeing it. I've not seen it with other people. So within your team, you already know that this is what we require with resources, human resources per se, and you actually position yourself into it. So if someone is going to invest, I'll know that, oh, for sure, Ayomide is going to do project management. Okay, this guy's got something it takes to start. But I am not able to connect all of the dots as you were presenting, what the needs were, what the problem, I know what the problem is, what is going to solve, but you were not able to articulate it better for me. There was a whole lot of data points that were missing. So next time, dig deep a little, connect all of those data points, talk about dental problem, you have verified with World Health Organization. It is a problem in country. A lot of people don't go to the dentist. People don't know they need to brush twice a day and all of that. Yeah, there is a problem. How are you solving the problem? How are you using ML to solve the problem? Not why you chose ML. Oh, these are the benefits, but you need to talk about if this is a problem. This is, if we put this in there, if we put AI in here, this is how AI solves the problem, not how ML is going to work. We don't care about the benefits of ML. How your product is going to solve the problem you have defined. from the onset. So that is it for me, so that we don't keep you so much here. We have other teams to talk to. Thank you so very much. Really appreciate it. I've said this to everyone. I hope this is not just you coming to do a research and present. I believe this is something you want to work on, right? I believe this is a product you want to bring to life, and you could bank on our support as much as possible to bring this product to life and ensure that this product is out there for people to use. Thank you so very much for your time today.
Thank you very much, sir. We
Thank
appreciate it.
you.
Thank you for
Thank
the
you
All
all.
right, thank you. Thank you so much.
Thank you, sir.
Data readers, you may leave the room now.